officially an academic role at the University of Kent and Canterbury, but that includes both a role in terms of teaching. I obviously have quite a big research role, and then I also do what we call at the university consultancy, and that is what takes me away from the university and into services a lot of the, a reasonable amount of my time. I tend to work a lot with organisations that are looking to improve the practice that they and the support that they give individuals with intellectual disability or people with autism. Most of them are organisations for adults, although I do work occasionally with some schools, particularly schools that are providing support around people with children with autism. From that, and I work at a number of levels within organisations. Usually, my main role is working with senior managers, and the aim there is to help them to understand what they need to do to improve the quality of the support that they provide, helping them to think about a framework, helping them to understand active support, because there's not much point in trying to implement active support, something you don't understand. Well, you can try, but it's not going to work very well. And helping them to develop a strategy for example, training, for support for staff, to think about the importance of motivation, of what staff think they want, and how do staff know what they want. So working through lots of the issues that are really about implementing good practices in the long run, and maintaining them over time, and helping them to understand that just throwing training at a staff team and leaving them to it is not going to be enough to maintain good practice over time, and that they have to keep their eye on the ball. So I usually do, before I train any staff in any organisation, I usually spend a day, at least a day, with the senior management team and of any organisation, and make sure they understand what they're getting themselves into and what their responsibilities are. Usually once I've done that and we've got a training strategy, we work with organisations to start to think about training trainers, and also to look at their systems and their processes. Usually from my point of view, it's around observation. It's around helping them to be able to reduce paperwork type methods and to introduce more observational methods. Now, in the UK, we've got a system whereby almost all services, registered services, must have somebody visit from the senior management team once a month. And that's a requirement from our Care Quality Commission. So it's one of the things they have to tick off. And so many times it's not about changing, it's not about adding new systems, it's about changing what they do. So in services that are organised, like in, for example, group homes, we can just change what they look at and the fact that they should spend some time just watching when they go in to do a monthly visit. And they don't have to do it every time. Most organisations, we say, even once every 6 months, unless you see a problem. But once every 6 months, doing a slightly more formal observation is usually enough to check if things are going wrong, and then to start to put things into place, and also to pick up and reward good practice, feeding that back up through the organisation. So we train trainers, we train observers, we train a whole range of people at a kind of more middle level. And then sometimes I even get the pleasure of training staff teams myself, and to work not only in the classroom-based setting, but hands-on with staff teams to implement active support. Where we're lucky, sometimes organisation will fund a bit of evaluation, so a pre and post, and we get to demonstrate the impact. And if there's not an impact, we help them to figure out, well, what's gone wrong? Because we know it works, and quite often something will have been missed out. The motivational structures won't be quite right, or they're getting a confusing message, for example. Or just a very resistant staff team, a staff team that doesn't want to change, and they haven't been able to solve that. So we use quite a lot of problem solve, help them to problem solve over time. And the organisations vary from big national organisations down to services providing 1 or 2 group homes, for example. The national organisations are usually providing a range of services. So some of them will be group homes, some that provide day services as well, some supported employment services, and quite a lot of them now will provide outreach or even 24-hour in-home support for people with more severe and complex needs. And they may be having a direct payment, those people, or a personal budget so some form of individual payment, and they usually are renting. In our society, in our context, they don't own their own home very often. Occasionally people have maybe family money that they've invested in, and they or their family actually own the property, but usually they are renting. And because our housing is relatively expensive in most areas, rarely do they rent on their own. So there's a lot of different models, they have people sharing the accommodation with staff being bought in. And we do have the situation where somebody might have their staff from one organisation such as United Response, and the other person living in the same flat might be buying their support from another charity or another provider, and who's providing their individual budget or individual support through their individual budget. But there's lots of flexibility in that system. But usually because they're through an organisation, they get all the same training as somebody who was working in a group home. They'll have a team manager, they'll have people who will be providing ongoing training and support and that kind of thing. So it's quite wide and varied. And I guess the only other thing to say is also about working at a systems level. So some of the work I've been doing more recently in the UK has been with our Care Quality Commission, which is really about changing the way inspectors look at services and skilling them up to look at active support, to look at engagement and interactions between staff and the people they support. Helping them to develop observational tools that they can use, things that they should look at around active support, positive behaviour support, engagement and meaningful activity. So really trying to think about what training inspectors will need and what they actually do when they go on a visit, and the importance of observation in that.